Welcome to this explainer on the revenue rescue journey. Now, if you've ever felt that sheer absolute dread of a stalled claim or, a super tense patient billing conversation, well, you are definitely in the right place. Today, in part 30, we are decoding the exact back-end processes you need to rescue delayed revenue and keep your clinic financially thriving. So, here's our roadmap for today. We're going to break down rejections versus claim denials, dig into the root causes of unpaid claims, figure out how to track AR aging, walk through the claim appeals workflow, and finally, touch on ethical patient billing practices. Let's get right into it. Section 1, rejections versus claim denials. Let's look at what actually happens when a claim just goes wrong right out of the gate. Okay, there is a massive difference here that we need to talk about. A rejection, that's just a front-end roadblock. Basically, the claim never even entered the payer system because of missing data. Think missing patient ID, sex, or birth date. You just fix it and resubmit. But a denial, that's an adjudicated refusal. The payer actually reviewed it and essentially just said no. Whether it's a missing prior authorization or someone forgot to check that accept assignment box, denials require a much heavier lift to rescue. Moving right along to Section 2, root causes of unpaid claims. Let's uncover exactly why these claims get stuck in the first place. As a biller, your whole job is to spot these traps before they spring. And the absolute biggest culprit? Timely filing deadlines. I mean, if you miss that strict 90-day window for a commercial payer, that money is literally gone, no way around it. Other massive traps include skipping prior authorizations, which, remember, happens before the patient even sees the doctor, or messing up demographic info if they aren't the primary policyholder. Honestly, prevention here is absolutely your best revenue strategy. Now, this is incredibly frustrating, but simple technical formatting issues can freeze your revenue instantly. Under the 5010 electronic platform rules, the system is completely unforgiving. If you bill with a tax ID instead of a HIPAA-required NPI, stopped. Use a P.O. box instead of a physical address, or miss just a single digit and a 9-digit zip code, stopped. Even putting more than 4 diagnostic codes on a standard HCFA form triggers an automatic error. I know, it sounds super petty, but these tiny technicalities have massive financial consequences. Which brings us to Section 3, tracking accounts receivable aging, because we have to actually find these stalled claims, right? To do that, you've got to track those delayed payments across your 30, 60, and 90-day aging buckets. Your main strategy here? Always attack the high-dollar claims and the oldest accounts first. Most practices can tolerate accounts sitting for, say, up to 90 days. But once you cross that 90-day threshold, your cash flow is in serious danger. You really should be checking these outstanding claims every single day. And when you finally get a payer on the phone, after surviving all that terrible hold music, you must take control of the conversation. Ask authoritative questions. Things like, what is the specific claim number in your system? What exactly is delaying it? And most importantly, when will you pay? Don't just hang up after that, though. Document every single detail, including the rep's reference number and the agreed-upon timeline, directly into your billing software. Okay, Section 4, the claim appeals workflow. When a claim is unfairly denied or underpaid, it is time to initiate the tactical battle of the appeals process. Winning an appeal really comes down to structured persistence. You want to start by translating the payer's CARCs and RARCs. Those are the claim adjustment reason codes and remittance advice or mark codes, so you understand exactly why they denied it in the first place. Make a phone call first, because sometimes a simple conversation solves it instantly. If not, escalate to a formal appeal letter and immediately set a 30-day calendar tickler alert to follow up. Literally, never send an appeal into the void and just cross your fingers. Now, that formal written appeal, it must be a bulletproof, factual case. It is definitely not about writing an angry letter. It is all about presenting undeniable data. You have to include the claim number, the exact date of service, the total amount billed, and your clinical documentation. And hey, if a contract dictates they owe you a specific amount, cite it. Tell them exactly what you expect to happen and set a firm deadline. And keep in mind, when you're dealing specifically with Medicare, you're climbing a highly strict, completely unforgiving ladder. You start with a request for redetermination. If that fails, you escalate to a QIC reconsideration, which usually yields a written judgment within about 60 days. The final step is an administrative law judge hearing. But here's the catch. Upper-level appeals rarely accept new evidence, so you absolutely must stack your deck with all supporting documents right at step 1. Finally, let's pivot to Section 5, ethical patient billing practices. This is the human element of revenue recovery, where your diplomacy skills are truly tested. Because listen, your ethical obligations absolutely do not stop at the keyboard. As a biller, you're often the one delivering stressful news about, say, a 20% coinsurance or some unmet deductibles. Empathy and integrity here are just mandatory. You have to apply the exact same ethical standard to how you collect from patients as you do when coding. It protects the patient, and frankly, it protects your practice's reputation. Patient interactions can be pretty turbulent sometimes, especially over large, unexpected bills. So act as a diplomatic advocate. Listen first, and please don't overwhelm them by over-explaining your billing software. Instead, offer practical solutions like installment plans or using credit cards. Remember, most people simply do not understand their explanation of benefits. Taking just 2 minutes to educate them on basic insurance concepts can de-escalate a tense situation instantly. To protect your practice from compliance issues, you really need to follow a rigid workflow. First, apply your charging policies equally to everyone, regardless of what insurance they have. Second, document every single agreement made over the phone. And third, standard practice dictates you must bill a patient clearly at least 3 times before even considering debt forgiveness or sending them to outside collections. Consistency is for sure your ultimate legal defense. By mastering this revenue rescue journey, from preventing front-end errors to forcefully appealing those denials to respectfully collecting from patients, you cease to be just back-office staff. You become the financial heartbeat of your clinic. So, I want you to look at your aging reports tomorrow and ask yourself exactly how much hidden revenue is waiting for you to rescue it. Please like, share, and subscribe to Decode Healthcare with Harshal.